As Washington State and several other states grapple with measles outbreaks, this issue could not be more timely. I remember in 2000 when measles was officially eliminated from the United States, and what welcome news that was for families across this country. And I remember the years of efforts that actually led to that victory. Before the vaccine was available, measles outbreaks used to spread through communities like wildfire. If you were old enough to drive, odds were you'd already had measles. But today, vaccines that protect against measles have been in use for over 50 years. Like other vaccines, we know the vaccine is safe, it's effective, and it saves lives, which is why today a generation of students are starting college, almost none of whom had to worry about a measles outbreak at school. It also means a generation of new parents may not appreciate just how dangerous measles is. Before introduction of the measles vaccine and widespread vaccination, millions of people caught measles annually, meaning thousands were hospitalized, hundreds of people died, mostly children under 5 years old. But measles isn't just deadly. It's also one of the world's most contagious diseases. It is easily transmitted through coughing and sneezing. It can linger in the air and on infected surfaces for 2 hours. It is already contagious 4 days before an infected person develops a rash, and then another 4 days after. 9 out of 10 unvaccinated people exposed to measles catch it. That's why the measles vaccine is so important in providing protection. Experts say in order to establish herd immunity against measles, in order to prevent an outbreak from occurring within a community, at least 95% of people should be vaccinated. Meeting that threshold is crucial to protect people who are unable to get vaccinated, infants, those with certain medical conditions. Unfortunately, while the national vaccination rate remains high, in communities across the country, we are falling behind. Vaccine coverage rates are declining in certain areas, contributing to the rise in preventable outbreaks, like in Clark County, Washington, where public health officials continue to respond to a measles outbreak. The immunization rate among children in that community is less than 70%, far below what is needed to keep families safe. The result is a true public health emergency, over 70 confirmed cases and counting, and the majority of cases have affected children under 10 years old who are unvaccinated. Each case isn't just a concern for family members who are worried about their loved ones who are seriously sick. It is a threat to neighbors and communities left struggling to get an incredibly contagious disease under control. It's a terror for parents with newborns who cannot yet get vaccinated, and a strain on our public health system as hundreds of staff in Washington State are pulled from critical public health roles to respond to this crisis. And the Centers for Disease Control and Prevention stretches to support the response to outbreaks in Washington and several other states. Measles isn't the only disease that deserves our attention amid slipping vaccination rates. Diseases like the chairman mentioned, mumps, pertussis, or whooping cough, are also cause for concern. These outbreaks are a clear sign we've had to do more to address vaccine hesitancy and make sure parents have the facts they need to understand the science. Vaccines are safe and effective and life-saving. Parents across the country want to do what is best for their families to keep them safe, which is why they need to be armed with knowledge about the importance of vaccination, and why we need research into vaccine communication tools and strategies to help us better educate people to address vaccine hesitancy and build vaccine confidence. We also need to understand the roles social media and online misinformation play in spreading dangerous rumors and falsehoods. And we need to better prepare the full spectrum of healthcare providers, who are often the professionals people trust most, to counter vaccine hesitancy and promote vaccination. That's important not only for parents, but also for expectant parents who may already be deciding whether or not they plan to vaccinate, and for promoting adult vaccines and encouraging people to protect themselves and others throughout their lives. I look forward today to hearing from Dr. Weissman about how Washington State is working now to get parents reliable information about the importance of vaccination, and from all of our witnesses who are here today about how the federal government and other partners can promote vaccines and prevent the spread of misinformation. And while we are now fighting multiple measles outbreaks, it's important we also educate people on the HPV vaccine's role in preventing sexually transmitted diseases and lowering cancer risks, the flu vaccine, particularly on the heels of one of the most deadly flu seasons in years, the whooping cough vaccine, especially for those around infants who are particularly susceptible to the disease, and the value of other recommended vaccines. We also need to make sure we are approaching the public health challenges like this from a global perspective, because we know diseases are not stopped by borders or walls or bans. They are stopped by doctors and nurses and vaccines and public health awareness. And they're stopped by strong investments in public health systems here at home and abroad. They say an ounce of prevention is worth a pound of cure. That's certainly the case here. A dose of MMR vaccine covering measles, mumps, and rubella is about $20. Meanwhile, Washington State has spent over $1 million already addressing the current measles outbreak. Investing in prevention isn't just more effective at keeping our families and communities healthy, it is more affordable as well. The Vaccines for Children program is another great example of this. Over 25 years now, it has helped kids in low-income families get shots at no cost. It has saved $1.6 trillion, prevented 380 million illnesses, and saved 860,000 lives. That's more people than live in Seattle. So I hope we can work together in a bipartisan way to build on programs like this with strong steps to help address public health crises and, better yet, to prevent them from happening in the first place. And I'm glad to have this opportunity to learn more about how we can do that and to consider how to make sure people across the country understand that vaccines are safe and effective to keep their families and their community healthy.